Hi, Jim. First of all, I just wanted to thank you for your wonderful website. I recently just had my first baby, and
Congratulations.
thank you. And just a couple days after I had him, I started having extremely loud tinnitus and other um, stress-induced symptoms, tightness in my chest and TMJ, and um, about a month after that things started calming down a little bit. And then I had a new sound in my head. And it was that symptom that led me to finding your website. So it's just really cool to know that there are people out there who actually care about these things and are specific with their listing of the symptoms. I really appreciate that. It's already helped me so much to recognize these things and learn. I'm starting to learn to not react to the symptoms I have and stay calm in stressful situations because having a 2 month old does mean that you have a lot of stressful situations.
Yes, you do.
Um, so
Yeah.
I guess my question is like, how do you, when those symptoms, I've had them kind of go up and down as I've been going through this. I've struggled with anxiety all my life. I think I've probably had anxiety disorder before, just kind of without realizing it. Like I look back on, particularly high school, just not being able to sleep and just kind of paralyzing fear all the time.
Mm.
Um, and so, how do you face those fears of like the unknown symptoms or the unknown setbacks? That's kind of the hardest thing for me.
Sure. Yeah. I'm sorry. When did you have your baby?
I had him 2.5 months ago.
2.5 months. All right. Yeah, yeah, yeah. Okay. Well, again, congratulations. And they are a lot of work and they're a lot of stress at the beginning. Is this your first?
Yes, my first.
Okay, so that's even more stress.
Yeah.
So it's understandable. Yeah, yeah. One thing is they're pretty durable, so I don't have to stress about them too much. Yeah, dealing with rebounds and ups and downs of symptoms is, very typical for anxiety disorder. That's just how it works. You can, go to bed one night feeling, oh, I got this beat, wake up the next day and it's all back. Or you can be going through the day and feeling great, and all of a sudden you get a wave of symptoms. That is how it is. Or you can have symptoms 24/7, once your hyperstimulation gets up there. All these are common. Um, when it comes to symptoms, again, you want to go to the doctor, make sure they are anxiety symptoms because there's a lot of medical conditions that can cause similar. So we want to make sure that's ruled out. Having a baby, your body's going to be adjusting and it's going to take some time for it to adjust. And that's stressful. And you got hormone fluctuations going on. And then you have the pressure of getting up and what's the baby doing and how's the baby working out and is everything ready? Plus living your normal life. It all is stressful. So in that time, as your body adjusts and as the little one gets a little bit older, you are going to be having ups and downs and things. And the best way through it is if you've had a medical evaluation and all your symptoms are anxiety related or stress related or hormonal related, yeah, just accept them for that. This is it. These are temporary. My body is going to adjust and things will settle down and all my symptoms will subside. That's one thing we want to keep in mind. They all go when our stress comes back down to normal. None of them stick around. They're there really just letting us know that the body is overly stressed, period. Or, going through the changes that your body's going through. So come to that place of peace with them. If we're anxious, and you mentioned that you might have had some anxiety issues before, the common thing that happens with us is our anxious behaviors get our stress up, then our stress causes symptoms, and then we start worrying about the symptoms. Well, we just keep everything going. The best way to work through that is just to not worry about them, focus on reducing stress where you can, and give your body plenty of time to adjust. And that's an emphasis on that. Your body needs plenty of time to adjust. Once the body becomes hyperstimulated, it doesn't resolve quickly. You just got to give it the time necessary. Just excuse me for 1 minute.
Yeah, I think that's the hardest part is trying not to be impatient about waiting for that recovery and for those symptoms to, as they fluctuate, to not be frustrated when they come back or when they get more intense.
Yeah, and that just takes practice too, right? Because especially when our symptoms are new and they come out of the blue, we're conditioned to think, okay, what's going on here? And then we start worrying about that. But once you get used to them, and as you get used to them, it just gets easier to dismiss them and say, yeah, that's just that, and never mind. And like, I was talking with Fivo, it just takes some experience and time for that to set in. So I would encourage you not to beat yourself up if you have days where you chase them down with worry. That's kind of common. Just give yourself some grace and say, yeah, it's going to take me some time to get really good at accepting these. But, it looks like you're young. And so as you do this now, all the way down the road, you won't have any issues with this at all because you know what they are. Sound okay?
Yes, thank you so much. I appreciate it.
You're more than welcome. I hope you have some support with your newborn.
I do. I have an awesome husband who has supported me through all of the ups and downs with my symptoms, has listened to me and my cyclical thinking about it, my cyclical worrying about it. He never loses patience with me, and I don't know if I would be able to start feeling better, which I am,
Uh,
without that. So,
that's great. Good for him and good for you. You have a good match there and you should be through this. I would at some point, and you have time, is to maybe connect with a therapist to uncover some of the more invisible underlying factors so that anxiety isn't an issue down the road. Because as we get older, we have more challenges. Even though, a newborn is great and, they're demanding initially, as they get older, their demands are in a different way. So as we get older, we experience more stressors and challenges. So it's nice to get those underlying factors addressed sooner rather than later.
thank you so much.
You're welcome. Thanks for joining us, by the way. I also wanted to mention that, we want to keep in mind that as the body prepares through pregnancy, the hormones are changing, the body's changing, and that's stressful. Then when you have delivery, that is stressful with the pain and preparation and so on and so forth, the trauma of delivery. Sometimes there's medical intervention and so on and so forth, which all stresses the body. Then after that's over, then you have recovery time, including looking after the newborn. And if it's the first one, you have all the stress of, what's going to happen? How's the newborn going to survive? What do I need to do? Preparing meals, all those kind of things on top of your regular daily activities. All of that's stressful. And through the whole time, hormones are changing and hormones affect other hormones. And so you have the stress of the pregnancy and delivery, and then after, and then you also have the stress of the hormones changing and affecting others. And so you have quite the recipe of a lot of stressors going on that all affect the body. And of course, as you know from our website, hyperstimulation takes time to recover from. And once the body becomes hyperstimulated, it's just not going to reverse very quickly. So we have to be patient. The worst thing we can do is start to worry about the symptoms. And that's why I mentioned that if you've had your symptoms discussed with your doctor and your doctor has attributed them all to pregnancy or stress or anxiety, then you don't have to worry about anything else. Give your body time to adjust, accept the symptoms for what they are day by day. Also, keeping in consideration that they can fluctuate up and down. And so you want to be passively accepting them through the course of time. But as you do that and you reduce your stress and give your body time to recover, you will see all those symptoms subside and normal body function return. So again, the worst thing we can do is worry, because worry keeps that stress hormones going, which affect other hormones. And so we want to be as calm as possible, reduce stress as much as possible, give the body time, and be patient. And through it all, you should find that your symptoms all subside and normal health returns.